Thanks for tuning in. Today I'd like to talk to you a little bit about a newer concept that we use in healthcare called minimal incision surgery. Many times when we're looking at a surgical correction for a problem, we're limited by certain factors such as age, health, length of recovery, the amount of disability that happens after the surgery. There's a lot of things that can go on, and risk of infection, the list kind of goes on, and we have to weigh those factors to determine what the best option is. Sometimes we find that with patients, the downtime, the recovery, the potential for taking you off of your normal schedule is so high that we end up not doing surgery on you. And oftentimes that works okay, but for many people, there are problems that they want to have fixed. The problems are still there. If we could just find a way to overcome a lot of that risk. This is where minimal surgery comes into play. Instead of creating a large incision to access an area to surgically try to repair that, we're able to access the area through a very small incision, sometimes only 3 to 4 millimeters wide. That's less than half the width of your little fingernail. So with a small incision, we're able to now get in and do repairs in joints, repairs to bone, help to correct deformities, and help to restore better function to areas, which decreases pain. So in many cases, minimal incision surgery is allowing us to provide a solution for people who've been overlooked. The other benefit is minimal incision surgery can be done in an office setting. We don't always need to take you to a large OR or a surgery center to provide that. So for many people who are looking at the cost of healthcare and how do I afford to have something done, this now opens the door to where many people now can financially make this feasible to do. Minimal incision surgery is a very straightforward process. It's been used for many, many years, and it continues to progress as equipment and techniques are advanced. There's new imaging and things that are available now. So honestly, it's a great solution. With minimal incision surgery, you first of all see a very low rate of infection. There's not much of an incision. The portal for infection is very small. Second thing that we see is because of the small incisions, we see very little post-surgical bleeding and oftentimes much less swelling than with our traditional open surgeries. We also find less pain. Quite often pain management is cut off or decreased just after a day or two because patients don't feel like they even need a higher strength pain medication. And oftentimes we just cover them with over-the-counter medications. The other part that's very exciting about minimal incision surgery is it allows a much faster return to function. Where many open surgeries require an extended period, maybe a month to 2 months of not walking and weight bearing while we wait for bone and tissue to heal, minimal incision surgery actually permits you to begin walking in most cases the very next day. In fact, if you don't walk, you don't heal as well. By standing and walking, you help with the repair process, right? And so that's what's really exciting about this is it's a much quicker return to function. And because we don't have to necessarily take you to a large facility to provide that, the facility cost is much less. It makes the surgery much more affordable. So for many people who don't have great insurance coverage or don't have insurance and have been living with the problem for a long time, unable to really look at how do I afford to get this done, this now opens the options for so many people. We've been excited about minimal incision surgery. We've used it in our practice and seen very good results. Excellent post-operative, post-surgical results, as well as shorter recovery times. As a surgeon, we have all the options available to us. I can take you to a hospital. I can take you to a surgery center. We can offer traditional surgery that oftentimes requires screws, wires, internal hardware is what we call it, to help hold everything in place while it heals. But minimal incision surgery offers the option to provide surgery without any metal left in the body. That's another advantage in through there. So it might be something that's right for you. If this is something that's interesting or you have questions about, would like to know more, let us know. Reach out to us. We'd be happy to talk to you and look if this might be a good option for you in your case. Like everything, one option doesn't fit for everybody. We're unique. We have unique needs and requirements that we have to take care of. There's different variables to factor in, but for many people, minimal incision surgery opens up options that were not available before. So we'd like to hear from you. Hope to hear from you soon. Thanks.